Hi, I'm Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and today we are going to talk about eye care in cats. The most common eye problems that I see in cats would be eye infections, scratches to the eye, and occasionally cataracts and/or glaucoma. Clinical signs of an eye infection in cats would include redness to the eye, generally in the white of the eye. You may notice that your cat is squinting, which is a sign that there is pain in the eye. You may notice ocular discharge, so there'll be a drainage coming out of the corner of the eye or along the eyelid margin itself. Color is a big indicator. So if the discharge that you're seeing in your cat's eye is green or yellow, that's a clear sign that there is a bacterial infection going on. Clear or watery discharge may or may not be associated with an actual infection, but those would probably be the most common signs that I see in cats in my practice with eye infections. Generally speaking, an owner will not be able to actually determine that there is a scratch in their cat's eye, but any injury to the cornea itself is extremely painful. And so the most common sign associated with a corneal scratch will be a cat that is closing their eye. They're reluctant to look into light or have bright light shown into their eye, and they're definitely squinting and holding that eyelid closed as much as, or those eyelids closed as much as possible. Cataracts are a situation where the lens capsule in the eye opacifies or turns white. And it may be a small or focal opacity, or in an advanced case, it may be that the entire lens itself becomes opacified. Again, like a corneal scratch in the eye, an owner will not likely be able to diagnose a cataract per se in their cat's eye unless the cataract has become large enough that they can visually see a white circle in the middle of the cat's eye. We don't commonly see advanced cataracts in cats. I see that problem generally more so in my dog patients, but it absolutely can happen in cats as well. Ulcers in the cat's eye are the result of a loss of one or more of the layers of the cornea. The cornea is actually 10 cell layers deep. And so when one or more of those layers of the cornea is eroded or damaged, it causes basically a cavity or a crater on the surface of the cornea or the eyeball. Again, in mild cases or very early ulcers, the only thing an owner will generally be able to recognize is that the cat is squinting because it's a very, very painful process. The actual diagnosis of a corneal ulcer is made in the veterinary hospital. We apply special staining to the eye that allows us with special lighting to actually see the ulcer, the size of it, and the location of it on the cornea itself. The underlying cause for why an ulcer will occur in a cat is varied. It can be as seemingly innocuous as the cat got scratched on the surface of the eye, either in play or fighting with another cat, or maybe they actually just ran into something and it poked them in the eye, literally. And then that scratch doesn't get cared for, and so bacteria set in on top of that wound, and the bacteria are what starts to eat away or erode the corneal layers of the eye. The second reason, most common reason that I would see a corneal ulcer in a cat would be secondary to severe infections. Not necessarily just a scratch to the eye, but there are certain viruses in particular that we see in cats that can have a focalization in the eye itself and can literally just destroy the cornea, the surface of the cornea, if it goes on unchecked or untreated for long periods of time. So thanks for spending some time with us. I hope you found this little video informative and answer some questions you may have about your pets. If you have any questions, give us a call at Tuscan Ridge Animal Hospital.